Mr. President, June is Alzheimer's and Brain Awareness Month, an opportunity to join the global conversation about this equal opportunity killer, Alzheimer's. Everyone with a brain is at risk to, in fact, contract Alzheimer's. Worldwide, right now, there are 47 million people living with Alzheimer's and with other dementias. And without a change, these numbers are expected to grow to 76 million people globally with Alzheimer's by the year 2030. In 1998, my mother passed away from Alzheimer's. That's the year that I created the bipartisan Congressional Alzheimer's Task Force. And the reason I did it was that it's very hard, as people who have an Alzheimer's patient in their family know, it was hard to deal with this disease while my mother had it. But for me, it became something very important, something that I felt that the Congress had a responsibility to deal with. Because for 13 years, my mother just stayed in our living room, being cared for by my father. And my mother was quite fortunate because my father had been a milkman. And the right arm of a milkman carrying milk bottles for decades is the strongest right arm you can have. And so my father could care for my mother. My father could keep my mother in our home. But not every family has the strong right arm of a milkman. Keeping an Alzheimer's patient at home is a difficult task. And we just have to accept the fact that statistically, while we now have more than 5 million Americans with Alzheimer's, let me say that again, 5 million Americans, as we gather here on the Senate floor, have Alzheimer's in our country. But that's before all the baby boomers have retired. By the time all of the baby boomers in America have retired, 15 million of them are going to have Alzheimer's. And like my family, someone else in each one of those families is going to have Alzheimer's as well, because they'll be the family caregiver. So that'll be about 30 million people by the time all the baby boomers have retired, whose principal reality in life will be this one disease. Now, how big is this disease as a drain on our country? Well, this year, we are going to spend in Medicare and Medicaid dollars $153 billion on Alzheimer's patients. Can I say that again? This year in America, with 5 million people with the disease, we're $153 billion. How big is that number? Well, we're debating out here the defense bill for our country. How big is the defense bill to protect our entire country here and overseas? $560 billion. One disease, Alzheimer's, is going to cost us $153 billion. By the time all 15 million baby boomers have the disease, the amount of federal money in Medicare and Medicaid that we will be spending will be equal to the entire defense budget of our country. That is obviously non-sustainable. We have to find a cure for Alzheimer's, not just for our country, but for every other country in the world. We have to be the leader. Our caregivers are the heroes today, but even heroes need help. As the true neurological wasting effects takes hold, of the next generation of Alzheimer's patients, the cost to our society will mount unless we make the smart investments to treat and defeat this disease. We have an opportunity here in the United States Senate to provide the leadership. For every $27,000 in 2015 that we are going to spend from the United States Senate on Alzheimer's out of the Medicare and Medicaid budget, the National Institutes of Health invest $100 in trying to find the cure. That's right, you heard me correctly. We're spending, for every $27,000 of federal money this year on an Alzheimer's patient, $100 to try to find the cure. The NIH budget has to increase. It has to increase dramatically, because in the long run, you cannot balance the federal budget if one disease in 30 years is going to consume as much federal money as the entire defense budget in our country. Every 67 seconds, someone new in this country develops Alzheimer's. In my state of Massachusetts, 12% of all seniors have Alzheimer's. We need a breakthrough in research. Research is medicine's field of dreams from which we harness the findings that give hope to families. That children one day will have to look to the history books to find that there ever was such a disease as Alzheimer's. Right now is not the time to cut funding at the National Institutes of Health. They are the National Institutes of Health, but they're also the National Institutes of Hope. And we must give that hope to American families that we can find a cure. We cannot cut that budget. We cannot allow sequestration to come in and to slash the NIH budget once again. In 2015, the NIH has the buying power that is 20% lower than it was 10 years ago. This is at a point where it should be ramped up 20% higher. Not. This is a debate which we should be talking about. The terrorist call that people fear is that some doctor will call the house to tell them yet another member of their family has Alzheimer's or some other tragic disease. We need to increase the NIH budget. We need to give that hope to American families. And so that's why Senator Crapo and I worked to pass the Alzheimer's Accountability Act into law. It requires the director of NIH to submit an annual budget directly to Congress outlining what resources are needed to meet the goal of preventing and treating Alzheimer's disease by 2025. It's why my colleagues, Senator Stabenow and Senator Collins, and Senator Capito and I introduced the Hope for Alzheimer's Act, which will allow Medicare beneficiaries to receive comprehensive care planning services when they are diagnosed with Alzheimer's. It's also why Senator Wyden and I included the Independence at Home program as part of the Affordable Care Act. This program allows chronically ill Medicare beneficiaries, like those with Alzheimer's, to receive primary care services in the comfort of their home. Independence at Home allows teams of doctors and nurses to continue to care for severely ill Medicare patients in their home, bringing the house calls of the yesteryear physicians into the 21st century. Just last week, some game-changing data was released on the success of the first year of this program. We learned that when implemented properly, the Independence at Home program has the potential to save $21 billion of Medicare money over the next decade, and at the same time, it also improves the quality of care for Medicare beneficiaries. This is a win win-win situation. It is possible to design Medicare so that it works smarter, saves money, and improves the lives of beneficiaries. Patients want to be cared for in their living rooms, not in the emergency room. That is what my father, John Markey, the milkman, was able to provide for my mother with Alzheimer's. That's what Independence at Home does. It creates a program where nurse practitioners, physicians, nursing homes are able to say, we're going to help to keep your loved one at home. We will give you the help that makes that possible. Independence at Home is steering our healthcare system towards a focus of quality and not simply the quantity of care. As we build a future free of Alzheimer's disease, Congress and the American people need a blueprint on how to be more effectively prioritizing federal resources to reach our goal. When America makes a plan, America can do great things. We need an action plan to cure Alzheimer's and to care for those who suffer from it. In the 1960s, President Kennedy called for a mission to the moon, and we accomplished great things to make that happen. In the 21st century, it is not a mission to the moon, it is a mission to the mind, which is our challenge. And we must make the same kind of investment in research that was made in the 1960s. We did not allow the Soviet Union to dominate. We cannot allow this disease to devastate 15 million lives with Alzheimer's in this baby boom generation. The legacy we should be leaving is that we have found the cure. It was first identified more than 100 years ago. We now have to make sure that our legacy in the 21st century is that we have been able to build the momentum, to fund the research that ensures that families in our country have hope. So I thank you, Mr. President, and I yield back the balance of my time.